Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak again to Dr. Preeti Malani, the Chief Health Officer of the University of Michigan, which is open for students, staff, and faculty this fall. We talk about questions of health, safety, and behavior on campus. Let's listen. Dr. Malani, thanks for coming back to the Public Health on Call podcast. When we last talked, the question was, what is going to happen in the fall with universities? Tell us what's happening at the University of Michigan.
So Josh, thanks for having me back. It feels like it was a long time ago that we talked, and a lot's happened. And I'm really pleased to say that the University of Michigan, along with a lot of other schools, plans to conduct an in-person semester. This is really based on public health strategies to try to mitigate the risks. So things like social distancing, wearing face coverings, as well as symptom screening and quarantine. And the hardest one, which is limiting large gatherings. But it's been what I describe as kind of a modern day Manhattan Project to get us to this fall plan. And it's been the work of dozens and dozens of people at many hours.
Let me ask you first about academics. Is the University of Michigan, like a number of other schools, moving most, if not all, classes online?
Yeah, so this is a great question. And overall, I wanted to emphasize too that students can choose from a mixture really of instruction depending on their needs. So for a lot of them, a lot of things will be remote or hybrid. And then, of course, there's some things that can't be done remotely. So studio work or, music, as well as some labs. And the issue of choice has been something that we've tried to really recognize because some students, they either don't want to be in residence or can't be in residence safely. Wanted to make sure that they would have some flexibility. But the decisions on like what to teach and how to teach is really being made by schools, the individual schools and colleges within the university based on their own needs. And in general, large classes will be held remotely. Smaller classes will be held in person discussion groups. And then medium classes might be a hybrid.
I see. And if people can't be on campus, will they be able to kind of tune in to the small classes?
Absolutely. And it's hard to have a total number now, but there are definitely a portion of students who, for whatever reason, are going to be safer at their permanent home or wherever they want to be this year. And then there are many others that are actually going to be living in Ann Arbor and not attending a lot of in-person classes, including my son, Nick, who you know. I think most of his classes in engineering are actually going to be fully remote.
So beyond the academic side, what other major changes have you had to make in terms of, say, the dorms or other kinds of structures of campus life?
Yeah, so this is complicated because, as we talked about before, colleges are really built around the idea of togetherness and community. And with COVID and the need for physical distancing, it's really trying to recreate this. And college campuses are pretty dense in terms of the population. And one of the big things is decreasing density, both in classrooms and academic buildings. So you're going to see fewer seats. You're going to see limitations on the use of gathering spaces, access to buildings, really trying to make sure only the people who need to be there, including our many staff, are there. In the residence halls, what I've talked about is that your room is your home and that your roommate is like your lifeline, and you need to really be good to each other because that's the person that's going to help you get through this. We're going to have some limitations on things like guests and wandering from one area of the hall to the other, and really trying to keep people as much as possible within their smaller groups. Dining will also look different. So some of the places where a lot of people would normally be in dining, there'll be limited seating options. And it'll be more grab and go. And this will be not just in the dining hall, but there'll be outposts across campus.
Are you going to use outdoors more than previously?
Yeah, absolutely. And I think this is something that is being planned. And we had one of the planning teams actually spoke about this last week around tents and the idea of putting up tents and what they're going to look like, and the idea that they'll be open and that they'll have furniture inside. And a lot of this will be for eating and for other gathering options. I don't know that classrooms will be able to easily use that space because there are so many classes. But as you know, being outside is one of the mitigation strategies, and it's going to be a lot safer to have gatherings outdoors as much as possible. So Michigan has a wonderful fall. It does rain some, but we're hoping to get through a good deal of the semester being able to use some of those outdoor spaces.
And how have the reactions been so far to the plans? I imagine you're getting the full range of possible responses.
Yeah, so the full range for sure. And I said something the other day in a town hall is that I hear concerns from parents, from faculty, from community members, but I really don't hear a lot of concerns from students. And I know, Josh, you, like me, are a parent of college-age kids. And I will say that I think the students are pretty excited to be back. They lost a lot last year when things overnight basically transported to a remote world. And I do think that they're excited to be back, and they're going to try their best, especially in classes. I do feel like they're going to follow the guidance closely. There is concern, certainly, from parents and faculty and staff. And part of it is that what I have indicated to people is it's not just making changes to make sure people are safe, but that they feel safe. And so we've been trying to do a lot of work around communications, trying to let people know that campus is not going to look the same. It's going to look different. It's going to feel different. And that these measures are being put into place to recreate it in some ways. But as you know, it's sort of been a mix. But overall, I'd say the reactions have been very positive.
So you're going to need not just a lot of compliance with all the different things you're changing on campus, but a lot of compliance in the off hours, because even the best laid plans here could go awry if there's some impromptu gathering and 300 people get together and give each other COVID. So what's the way you think about inspiring the kind of behavior that you want to see in the off hours?
Yeah, so this is, again, I think putting on my mom hat with this. Young adults need to be with other young adults. It's a natural instinct, and it's an important thing. When we think about well-being, I don't really like the idea of everyone sitting in their room by themselves for a semester. That just isn't healthy. But having large parties is also not something that you can do at this time. So what we've tried to do is provide guidance and really emphasize the need for a shared commitment, that this is really something that is not negotiable. It's essential. And our student life team has been instrumental in this, working with a number of student organizations, everything from fraternities and sororities and co-ops and intramural sports, trying to come up with safe ways to interact. And, as you know, it's the after hours things that create the potential for widespread. We know that returning to campus is not a zero risk proposition. In fact, it really assumes that the value of in-person learning and face-to-face education is so important that we have to accept some cases of COVID. But what we want to avoid are outbreaks and uncontrolled spread. And so these parties are a really big concern. We're working with our local government, with the city of Ann Arbor, the county, as well as the state, trying to come up with guidance and even considering different rules for the city of Ann Arbor in terms of outdoor gatherings. In our state, we still have a limit of 10 for indoor gatherings. Outdoor limit is higher, but it may be adapted for Ann Arbor to try to help prevent this. But it gets back to this issue that we can talk about all these mitigation strategies and changing the classroom and putting tape everywhere and testing people, but it comes down to behavior. And I have focused as a parent on talking about what can be done. Can we reframe social interaction in a way that improves safety? And I think one of the issues is having a smaller group, doing things outside as much as possible, going for a walk with one person. The days of I think when you and I went to college, and even for that matter, last year, where hundreds of people are gathered into a house. I mean, that's something that just absolutely can't be done. If it's done, then it's going to hurt everybody, and everyone's going to end up going home.
Some people would say it's just impossible to imagine that young people will avoid those scenarios, that it's just, an incredible temptation that they can't avoid.
That may be the case. And I'm hopeful. I actually think our students are doing their best. And, for that matter, we have had a campus full of students since March. Even when many went home, many have stayed. And they have, I watch them. I drive by, I see that they do gather in small numbers on their porches or on their lawns. I actually haven't been seeing huge parties like you normally would. And it may be that this happens. And we're seeing issues. I'm sort of paying attention to what's happening at other schools. I saw something at North Carolina. There was a fraternity party in a bunch of cases. Same thing at Notre Dame, I believe. But the other issue that we need to think about is that COVID is here to stay. It's not going to go away. Even with a vaccine, it's going to still be an issue. So how can we work around it, live around it, and reframe? But I'm hopeful that our students are going to try.
And you're talking about a cultural shift, which you can facilitate through these various mechanisms.
That's right.
Now, I want to ask you a slightly different question here, which is you're the chief health officer at the University of Michigan. And before COVID, you had things to do. There were health threats to students. During COVID, those other health threats haven't gone away. There's so much attention now in your line of work. There's so much attention on what it takes to keep students, staff, and faculty healthy. Do you think that any of that attention can rub off on other issues? Is it going to make those other issues even less important? How do you think about the interaction between COVID-19 preparedness and other types of health threats that may be out there?
Josh, I'm so glad you asked that question. And I think that that's something that with COVID becoming the most important thing in all of our planning, that all these other issues have been pushed aside and they haven't gone away. And these are the broader issues of well-being. And when we think about a college campus and students, it's the mental health, the physical health, the stress, the anxiety, the loneliness and social isolation that exists, which is sort of remarkable. But 60% or more in some surveys of students say that they are lonely. And I worry that COVID is going to make some of these things worse, and particularly if people remain remote and disconnected. But I also think it's an opportunity to reframe some of those issues and really think about community. These are difficult issues. They're not easy issues. The other piece is equity and inclusion. And as at the University of Michigan, we're very proud to have a very diverse group of students, socioeconomically diverse. And, remote learning is not easy for everybody. And it's harder for some learners. It's harder for people who lack access to broadband or computers and technology. So I do hope we take time to think about all those issues also. Health and safety always have to lead, but it doesn't mean that all these other issues shouldn't come into mind. And I was sharing with you earlier that one of the emails I've gotten this week from a parent is she's very concerned about her daughter living in a sorority house, which it's very crowded. There's many people in a room, and I'm concerned as well. But it occurred to me that COVID is one of many risks to these students. And that I worry about trauma, I worry about mental health issues, I worry about drugs and alcohol, sexual assault, all the other things that you worry about as a parent. And so we shouldn't forget those things because we're so focused on COVID.
Okay, well, thank you so much for talking me through where you are at the University of Michigan. I know you've been providing a lot of leadership to universities around the country too. So thanks so much for taking time to talk with us.
Anytime. Thanks, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.